Okay, good morning. Welcome, everybody.
Morning.
Welcome to Building an Effective Strategy to Manage Worker Safety. I'm David Frame with the Ontario General Contractors Association. As you probably know, this is the third and final edition of our leadership conference. Thank you, everybody, for participating. We expect another excellent day today with discussion with industry experts and industry leaders. So again, welcome. As always, we like to start with a safety moment. This is an important opportunity just to put safety first before we get into the proceedings. So does anybody have a safety moment they can bring forward? I'm gonna have to go to our panel because these are the only ones who can speak. I think I see Ron Kolowski with his hand up.
Yeah, thank you, David, and thank you, OGCA, for this series. The safety moment today, we should just reflect that we are entering again a third wave for COVID. This particular wave is concerning. It's a more significant virulent variant, if you will, of the COVID virus. We've done well so far. We've managed through the first wave with great diligence, great cooperation, and great collaboration within the industry. So I think it's just, we can't let our guard down yet. And I just would encourage everybody to stay the course, be vigilant, communicate with your people, and recognize that the major causes that we're finding of the virus spread is through community spread. Just people letting their guard down at breaks and at lunch rooms. Just encourage your site leadership to take that extra moment to talk to the people and just reinforce what we do so well and what we've done so well as an industry.
Thank you, Ron. It's an important message. We've, hopefully we'll see the vaccine roll out by this spring, and we'll quickly get through a third wave. But yeah, we've got to stay focused. Thank you. I also want to recognize our sponsors, which are 4S is our conference sponsor, and today's panel sponsor, Northbridge. And I want to note, as we noted before, that they have arranged to send participants some great promotional material by mail. And if you don't see them today, you should be seeing that early next week. Northbridge works closely with their broker partners, leveraging their in-depth industry experience. They help businesses operate safely so they worry less about risk and focus on opportunities. And we invite you to learn more about Northbridge at their website. I would like now to welcome Mario Canatro from Northbridge and invite him to introduce Ron Kolowski as our first speaker. Mario.
Thank you, David. I'd like to introduce the first speaker for today, Ron Kolowski, Chief Prevention Officer. So for the past 3 years, Ron Kolowski has been Ontario's Chief Prevention Officer. Prior to this appointment, Mr. Kolowski was President and CEO of the Public Service Health and Safety Association. PSHSA is responsible for providing health and safety services and advice to over 10,000 firms and 1.6 million workers. Mr. Kolowski has been working with the Canadian Red Cross as Director General and the National Executive Lead for Health Programs. Ron has developed a new provincial occupational health and safety strategy after extensive discussions with industry, labor, and the prevention committee. And today he will be explaining this and highlight the strategy. Ron?
Thank you, Mario. That's for the introduction, and thank you, panelists and OGCA and 4S. I just want to give you a little history. The prevention as an entity was transferred from the WSIB to the then Ministry of Labor in 2012, and my predecessor, George Gutsiotis, had developed a 5-year strategy from 2013 to 2018. I came in 2018, and everybody's probably wondering, so where's your 2019 2024 strategy. Well, I just want to give you a little history. When I started in March of 2018, work had already been undertaken to start the next strategy. We had a change in government in June. We felt it prudent to really try and figure out the direction that government was heading towards. And it was really clear right from the get-go from some of their preliminary work they had done with KPMG that, you know, the government was looking for measures. They were looking for, you know, evidence. They were looking for, you know, a demonstrable mean of demonstrating the value for money and everything that they were doing. So this was a very key, important point for us to consider. When we started into 19, we were intending to release the strategy in the spring of 2019. However, in early January of 2019, there were four things that came to light. One is they were going to plan to have the Metron inquest in the spring of 2019, and we know that for a whole series of reasons, it's still been deferred, and you know that in itself is problematic. But we had felt that since that was the, you know, genesis of what we would call Ontario's new prevention direction, we felt that having that inquest would have been important. Similar to that, there was a commission studied for the commission that was put in place for the WSIB called the Spears-Dykman report, and that was looking very extensively into the, you know, the operation and direction of the WSIB. And as you know, it has great influence. It's what funds prevention. It's what funds our fair, safe work practices, or the former inspections unit of the ministry. And there was also a study commissioned on occupational disease through Dr. Paul Demers of the Ontario Cancer Research Centre. And these have substantial impact given that 2/3 of the fatalities that are recorded in the province are related to occupational diseases. And then lastly, we also learned that the Auditor General was going to do her first review of the occupational health and safety system in a decade. And we felt it was important that we get her opinions. And we all know that the Auditor General never writes a report that says just runs like a well-oiled clock. So we wanted to make sure that we heard what she had said. So we had all that in place by December of 2019. And then we had fully intended to release it in the spring of 2020, getting a theme here in the spring. In March, we were all ready to pull the trigger, and COVID hit. And we felt that, well, how do you compete with COVID? But more importantly, what will COVID tell us as we go through about all of the work that we've done for the past 30 years and determining how ready Ontario is to implement things like risk assessment or hierarchy of controls and that type of thing. And it's probably good that we waited, because we learned a lot. We learned, you know, where the strengths are in the system and where, quite frankly, the weaknesses are, and where do we focus. So we've incorporated that. We've had extensive dialogue. Over 1,000 people have been communicated with. We've gone to our association partners. We've gone to the Association of Associations, our prevention partner, employer partners group, which represents pretty much every industry and association across the board. We've had public consultations. We've had web inquiry process that has gone through. So it's been pretty extensive, and we've come up with something that we feel addresses a number of the issues that we want to cover. And you know, a strategy to me is a guide. It paints a picture, like a lighthouse that says, okay, you know, head towards the light in a positive way, not like a bug heading towards the light or heading down a train tunnel. This is a light or a beacon that we can all direct ourselves to. And, you know, the strategy's goals, and I'm just going to rhyme a few of them off, and then I'll discuss more in-depthly what we want to do. The goals are pretty simple. We want to work as a system, and we've done, I think, a really good job of defining the system. And the system is everybody that's engaged in the health and safety journey. And in this room, we have OGCA, we have 4S, we have IHSA, we have no doubt private training providers, we have owners and constructors and general contractors, and labor and unions and policy and inspectors and WSIB. Clearly, if we all work as a system, which quite frankly, COVID has proven that we can start making some pretty significant inroads. We want to incentivize employers to do better. It's not just that we want a person to take a course, and that's important, but we want employers to understand the full continuum of what health and safety means. And incentivizing, I mean, we've worked really hard with IHSA and CORE and OGCA and their supportive CORE, the Supporting Ontario Safe Employer Program, which is the CPO Accredited and Recognition Program, and WSIB through the Health and Safety Excellence Program, to make sure that those incentives are available to whomever wishes to aspire to a health and safety management system, whether that's ISO, whether that's CORE, whether that's CSA 18001, or any other health and safety management system that exists out there. And there are many of them. We're working with excellence of care in the chemical industry, for example, that they would be recognized as a CPO standard off the bat. And when we recognize those who do, they are the people that actually achieve that level of credential, and recognize them both publicly as leaders, but also monetarily for reinvestment into it. And we also want those employers to influence their supply chain to ensure health and safety is always in the forefront. So when we include them in the strategy, a large employer that has achieved CORE or achieved ISO, we want them to do exactly what the City of Toronto or Infrastructure Ontario or Metrolinx or TTC or the City of Vaughan, which is to incorporate in their bidding process the importance and value of health and safety for their subcontractors, so that we make sure that health and safety is as important as the cost of the bid or as the quality of the work. We want to use research and evidence to guide the direction that we take. We want to make sure that if we're doing something, we're doing it on solid ground. I often say we want to take somewhat of the emotion out of health and safety, but start directing it where the problem is based on good science. We want to focus on outcomes and not necessarily outputs to measure our success. It's one thing to say we trained 100,000 people, but if we don't know who we trained in terms of their occupation or the types of injuries that that occupation is achieving, how do we know that we've actually made an inroad to reducing injury? We want to make it easier for employers and workers to access information. And it's another phrase that I say, we got to take the Google out of health and safety. Google is the biggest health and safety provider in the world, and we got to stop that. We need people to go to the right place to get the right information, to be delivered by the most qualified individuals we can. There is so much out there, and it's almost like high beams in a snowstorm. If there's so much information, people just they give up. They can't do it. They can't get the information they need readily. So we want to really work on how we provide that information in a manner that is easy for both providers of the program, but also people seeking to get information. We also want to look at understanding why workers get hurt. It's one thing to say an industry is bad, but it's another thing to figure out within that industry what occupations are getting hurt. So when we look at construction, for example, we know that there are many elements of construction. There's residential, there's industrial and commercial and infrastructure construction, there's general construction, there's also demolition and renovation. And when we look at those and we start digging into them, we find out that, Um, OGCA companies, as an example, have a stellar record, like 0.22 LTI rate. When we look at ICI, it's like 0.80. But when we look at demolition and renovation, it's 2.88. So we have to really start looking at why is that the problem. And then when we look at occupation, we find that by occupation, general laborers get hurt more than tradespeople. Why is that? Why do custodians get hurt the most? So, you know, it's one thing to look at Bob's business, who's maybe got 20 employees and has one injury every 7 years. You can't get a trend out of that. But if you look at 100,000 businesses of 20 or less employees, and it could be everything from landscaping to retail to small manufacturing to a small warehousing or trucking company. If we look at all of those and we look at their occupations and we find out that, gee whiz, general laborers with no training get hurt the most. Is there something we can do with that? We want to determine if training programs that we teach align with occupations and the injuries that they're occurring. So as I say, that if we teach 30 people in a classroom slips, trips, and falls, but the big problem is not sitting in that classroom, it's somewhere else, that's where we want to start to focus. So we really want to focus on where the problem is rather than where it isn't. So the strategy that we're focusing will have 4 pillars. And those pillars will be based on best evidence and measured performance. So that's outcome and data, and we're working with the WSIB to do that. The second pillar is to improve occupational health and safety knowledge and practice. So how we teach, who we teach, and what we teach. So we know that there are different types of learners. We know that government likes to have a convenient one size fits all, but we know that that doesn't work. And a really good example of that, and this was something that we found from COVID, that after SARS, a lot of emphasis was placed on building very comprehensive infectious prevention and control procedures within healthcare. And when we looked at that, we found that in a COVID environment, many of those documents were written for a regulated health professional. They weren't written for support people in a long-term care facility, a PSW, a support worker of some description. And really what we need to do is we need to make sure that we're teaching the people the right way with the right content that they understand. And we need to be able to figure out ways that allow people to access information that they've been taught, but maybe they only enter a circumstance, you know, once a year, and it's really not a routine with them. So we're starting to explore things like micro-learning. You know, virtual learning has come into play. We've got e-learning, we've got classroom learning, we got practical learning. We're hoping that the WA review will teach us, you know, give us information on the balance between what is it, how much in a classroom, how much practical, what works, what doesn't work. Third pillar is really supporting workplaces to fulfill their roles and responsibilities. And, you know, what are the tools and the training and the information and incentives that workplaces need to help them achieve excellence? And we're not only talking about large employers, we're talking about, you know, micro business under 5, the small business 5 to 19, businesses of 20 to 50 and 50 and above. Those businesses of less than 50 account for probably 80% of employment in the province of Ontario. And when we look at those 80%, that 80% of business, although small, represents 62% of the injuries that are occurring. So really, the fourth pillar is really focusing on those smaller businesses that need the support, that don't have full-time health and safety resources, that are able to go to a place to be able to get good information and to become safer through various programs that we can provide. And that links very well into what we're doing in collaboration with both our inspectorate and the WSIB And all of our training partners, whether it's our private providers that are working as health and safety excellence programs providers, our health and safety associations, the WSIB Health and Safety Program, and of course our inspectors going out to determine, you know, in a relatively new approach, which is called a compliance continuum, as opposed to simply saying, you didn't have a guard, here's your ticket. Why don't you have a guard? What can we do to ensure that this becomes second nature and not something you forget? And overlaying the strategy is obviously our continued effort to reduce traumatic injuries. You know, there were 355 more, or I can't remember the statistic right up, but we had a slight spike in critical injuries in 2020. Fatalities, obviously, it's important because those are the ones that stand out front and center, is an overlay to the strategy. Reduction of LTIs, because we do have a belief that you reduce near misses, you reduce LTIs, you reduce traumatic injuries, you reduce fatalities. So it's got to start right from the beginning. You can't work from fatalities backwards. We got to work from near miss forward to be able to get this done. And of course, the other major concentration will be occupational disease. As I'd mentioned, you know, out of 220 fatalities average, or 200 average in a year, approximately 2/3 are occupational disease. We know we have two priorities. One is addressing the issue of legacy occupational disease, but more importantly, it's working on starting today so that those legacy diseases don't occur 30 years from now. And really good data will help us do that. If we know how many people work in an industry, we know the priorities and requirements to be able to reduce the prevalence of a disease, whether it's through proper PPE or elimination or hierarchy of controls, then in 30 years we won't have issues of mesothelioma or silicosis or those type of things that are prevalent within the industry. And then lastly, there will be an overlay where, you know, you have a good, healthy and physical working environment, but you also need a psychologically healthy working environment. We know that mental health, whether it be described as violence and harassment, racism, or just pure mental health, as the industry has started to identify mental health in construction, is a major issue. We need to address that because in many cases, collateral issues associated with mental health and anxiety, whether it's distractibility, whether it's impairments, whether it's just inattentiveness. We know that 60% of physical injuries across the board have some degree of a mental health component. So how we address that is going to be important, and how we address it with all our system partners is really important. But I'll leave you with a bit of a good piece of news on what this strategy hopes to achieve. If we look at construction in 2011, it had a LTI rate of 1.42. If we look at construction at the end of 2019, it had a LTI rate of 1.14. So we see that the curve of the graph is heading in the right direction. Yes, we've had fatalities that are up and down like a pumpkin face, which is indicative of not having a good handle on things. But if there is good news, it is that the trend is going down. We want to be able to show that in all industry, that a flattening and declining curve shows that you have a plan. And that plan we need to stick to, be vigilant, not try something for a month and decide it didn't work because we didn't get the results, but start something so that in a year we can measure the effectiveness. In 2 years, we can measure it continuing. And in 3 years, we can solidly say that we've made a difference. So that's essentially what the strategy is intended to do. Thank you.
Thank you, Ron. Next, I'd like to introduce to you the moderator for this discussion today, along with our panel members. Our moderator today is Ken Rayner. Ken Rayner is the Infrastructure, Health and Safety Association Vice President, Customer Relations, Marketing Development, and Labor Relations, and has been with the IHSA since 2010. He is currently assisting in the creation of the IHSA's next strategic plan. Our panel members today include Raymondo Mollica of REMO General Contracting. Raymondo Mollica is the founder and president of REMO General Contracting Limited with over 4 decades of construction experience. He is the past OGCA chairman and is currently serving on the executive committee. He has always strived to provide work culture-based quality, respect, and most importantly, safety. And through Raymondo's leadership, REMO recently achieved their core certification. Our next panel member is Joel Melloul, President of Melloul-Blamey Construction. Joel has been involved with many facets of the construction industry due to his ongoing involvement in the family business his father founded. From summer employment to university co-op terms to junior roles, estimating, and leadership, Joel has gained a significant breadth of experience in both the field and the office. Under his leadership, their company was an early adapter of one of the first Ontario firms to achieve core, and Joel is currently chair of the OGCA. And our last panel member is once again Ron Kolowski. Ken?
Okay, thank you very much, Mario. And also thank you to OGCA for allowing IHSA to partner once again in this Leadership Day series. We've been doing it for many years. It's been a great partnership, and we look forward to this panel in terms of sharing the wisdom from our panelists to the participants. So really excited to speak to both Joel and to Raymondo today. I think what you'll find with them is they're going to have a lot of similarities, but there's going to be some differences too that will provide a lot of value to the participants when we get into what it is each organization is doing to ensure worker safety. So I'm going to start with Joel first. So Joel, as Mario mentioned, Melloul-Blamey was one of the first adopters of CORE. You became CORE certified in 2013. And what we're looking to do here from a panel perspective is Ron Kolowski has gone over what the plan and the strategy is for the province. And I think there's a lot of what Ron's mentioned that many of us in industry have been working towards for a long period of time. It doesn't mean we've accomplished it. It just means that it's ongoing and we continually have to strive towards improving. There's aspects of the strategy that I know that would be very applicable to what it is that your organization is doing and what you're focused on. So really looking for maybe an understanding of what the ministry is doing from a strategy and a plan to achieve what they want to do from a worker safety perspective across the province. Can you maybe share with us a bit about what Melloul-Blamey is doing in regards to its strategy and plan to ensure worker safety on the care and control that you have of your workers?
Yeah, for sure. Thanks very much. Yeah, when asked to speak on this topic, building an effective strategy to manage worker safety, my mind was racing on all of the different safety elements, like Ron was alluding to before. There's so much information. I was trying to sort out, where the touch points were and what things sort of caused us to move in particular positive direction when managing worker safety. And then I had to stop myself for a second and get to sort of the lowest common denominator aspect and more of a foundational aspect of what organizations need and what we needed in order to be able to get to the point of where we are today with worker safety. And that is working on your core corporate culture. So I think if you don't have a strong corporate culture within your organization, it's going to be very difficult to have a strong safety culture. You have to have made investments in your people, in the way you communicate with your people, the way you interact with your people. We're fortunate that we're a family business. So we've always had a sense of family amongst our peers in the organization, right from early days, 40 years ago when my dad started to today. We've managed to hang on to that sense of family and looking out for each other. And I think that potentially is one of the keys to what our success has been, is that family culture aspect and looking out for your colleagues created a strong corporate culture. It's something that is really hard to figure out how to build a corporate culture, but it's done with little steps, just like safety culture is as well. And so we were fortunate enough to have had a strong corporate culture and made investments over many, many years to ensure that we were a family and everybody was indeed truly willing to look out for their brothers and sisters on site. With that, then when it came time to get involved with CORE and having the management buy-in within our organization, then the commitment to get involved with this standard, when we made that commitment to get involved with CORE, that's when our safety program stepped up and overlaid on top of our existing corporate culture. And then everything sort of flowed from there. And really our safety culture changed when we got CORE certified and when we made that commitment. And certainly when management publicly made that commitment that this is the standard we want to achieve. At the time, it wasn't really necessarily needed to get work or to carry on as an organization, but we made the conscious decision that, you know, safety was important, and this was the way to demonstrate it to the world and to our peers and to our employees. It's certainly lots of work. It's not an easy thing to achieve. I think I call ourselves as maybe a mid-sized organization, still with the mentality of a small construction company. So there's a lot of hard work and ongoing commitment that management has to make to keep the energy going in this direction. And we've had some great success. I mean, we've certainly had lots of challenges. We came within, I think, a month of 10 years of no lost time injuries. And then we had an accident that happened where we had a fall, and it was no fatalities or anything, just some pretty serious injuries for one of our workers. He had all the training. He even had his harness on, and they were on the roof, and he was one of the older school guys that didn't really want to be told what to do, but he put his harness on because that was just what everybody was doing. He just decided he wasn't going to clip off, and he fell through a hole. That sort of was a bit of a wake-up call for everybody. That doesn't matter what generation you are, if you've come through the school of hard knocks, that things exist today for a reason. And he spoke at one of our safety symposiums, which is one of our strategies we do within our organization every year. Is we have a bit of a symposium where we bring the entire organization together, and we do some training, and we talk about different stories and things to share what we've learned. So those sort of things are the little ingredients that happen over time. It took many small steps for us to get where we are today, and easing into our third iteration now of course certification. I think our certificate number is like 0000033. So we're pretty proud of that. Yeah, so I mentioned before, without management support, you're going nowhere. So you're going to have to stand up as leaders of your organizations and make commitments to your staff and to your people and to your peers that you're going to follow through with something like this to help energize the safety culture within your organization. And you're going to have to follow through in good times and bad times as well. Like I said, it's not easy, and it's ongoing work. So certainly a focus and commitment from management is key. Without that, you've got nothing. And again, what I'm speaking to here on our experiences relates to two of the elements on the occupational health and safety strategy overview to do with improving the knowledge and practices aspect. So small steps, communication, culture, family, to me is improving the knowledge and practices within your organization. And then supporting and fulfilling occupational health and safety roles and responsibilities and achieving excellence to me, that comes back to more of the specific things you do within an organization to keep working towards your goal, specifically to do with safety. Ultimately, with anything in life and in business, it seems someone's going to always say communication is everything, and it is. So consistent communication with your systems, whether it's communication about your culture, your safety culture, your organization, what's happening in the government, in the province, these kind of forums, just to keep talking about everything is very important to support your employees. What's their safety concerns or questions they have, all of those things go without saying. Ongoing safety training is something that we do consistently, and I know there's lots of third-party groups that do that. We've elected to go the in-house route, and we're of a size where we're able to do that, and we feel that that's one of the keys to our success. Is we call it we say MBIs, so Melloul-Blamey eyes them when we have new hires. We bring them in, they get full day of training, and in the office and on site, so that we're sure and they're sure that there's an understanding of the expectations, and we can look each other in the eye and know that they know what's going on, that it's not just a box ticking exercise. One of the other important things that help us manage our worker safety has to do with our own certified safety reps that we have on our sites. Over half of our workers are certified safety reps. So that in itself sort of bleeds the safety culture across our group of individuals, because there's at least half of your workers on each site have already been trained to have that keen eye and have the safety culture as one of their mantras to enforce on site. So that's been one of our keys, I think, to success in managing worker safety. We certainly involve our employees in the decisions we make, and their input is vital along the way. The other thing too, you have to always take into account is trying to suss out before you even hire individuals whether they're safety passionate people right from the start. It's not always an easy thing to do, but certainly it's something that we try to do, and it certainly helps if you've got somebody right from the get-go that is already aligned with your safety culture and your strategy. So yeah, with that, I'm not sure how much deeper you want me to go at this point. Maybe we can.
That's great, Joel, for that. I want to just remind all the participants that there is a question and answer feature that you can submit questions in if you want to ask questions of the panelists or of Ron, and we'll be monitoring that throughout the panel. So please feel free to submit those questions. Joel, I have a follow-up question maybe in regards to, you're describing corporate culture. You're talking about how that started as a family and how that was really inhingent in terms of creating that atmosphere in terms of people looking out for each other, taking care of each other as families do. And then you talked about that moving towards a safety culture. Has anything changed for you and your organization regarding planning and strategy compared to maybe where you were 10 years ago? Can you talk about maybe how that's evolved when it comes to the management coming together and taking a look proactively about implementing a plan, a strategy?
Yeah, well, prior to, just in the number of people alone we have managing the safety aspect just within within our overhead or within our office, not necessarily on the field. 10 years ago, we had one person doing that within our organization. We're now I think we're at 5+ individuals doing sort of independent internal audits. So we've made the commitment to invest in the resources to do the planning, to stay on top of everything. I'm sure I've got a couple of them listening to me talk right now on this webinar as well. So certainly the planning aspect is, the core is what drives it really for us, because it keeps us on our toes, and it helps us stay accountable to the standards that we set ourselves, and that's the whole purpose of it. So without any kind of planning, you're never going to get there. So you've got to set out your goals, and put the resources to it. And it's a cost, but it's a necessary cost. And the investment we've made, apart from that one accident we had, we'd be probably staring at 15 years now of no lost time injuries, which would have been pretty tremendous. But we're right back at it. We're 3.5 years into it again. So and we would love to get to that 10-year threshold. So we talk about that at our management meetings. What is it we need to do now? What's the next focus now to plan out the year? Right now, the pandemic certainly had a lot to do with that. Is our focus now is healthy body, healthy mind. So we've got a bit of an information program now going out to our people on a consistent basis about how to pay attention to your mental health, and not even your own mental health, but keep an eye out for your buddy on site. If something doesn't seem right, it probably isn't. And don't be afraid to talk about it, and maybe seek help for them in some way if they're not able to do that. So yeah, it's like I said at the onset, it's a lot of work. You can never let up, and there's always something you can work on, and chip away. I guess the how do you eat an elephant one bite at a time? Well, that's what safety is, and if you keep eating, you're eventually gonna win.
Raymondo, if we can bring you into the conversation. So at REMO General Contracting, while you're an employer of a smaller workforce than Joel's organization, you've got some very significant projects that you've undertaken for school boards and municipalities. But you've got a very interesting perspective, I think, in terms of looking at not only the strategy that Ron talked about in terms of how small business see themselves in the strategy, or how the help that small businesses need. You've also recently achieved core certification as a small business, and wondering if you can just talk a little bit about that, being that those are two pillars that Ron discussed, is making occupational health and safety easier for small business, and then also supporting workplace parties to fulfill their occupational health and safety roles and responsibilities and achieve excellence. And one way they look at that is by achieving core certification. Could you speak a bit about that if you would, please? Oh, just got to remind you, you're on mute.
How's that?
There we go.
Okay, sorry about that. Thank you, Ken. So yes, REMO's a small GC. Like Joel, we're truly a family run and operated company. I think it's around 35% of all our employees are family. And it's growing, 2 grandsons in the last 4 months. So it looks like I won't be retiring anytime soon. But as a small GC, we don't have a dedicated health and safety division, as I'm sure most GCs don't have. But nevertheless, we've always strived to maintain safety as a priority. We were one of the first to support, the first original supporters and members of the League of Champions, because we felt that the league was comprised of like-minded leaders focused on safety. So like you said, we recently received core certification and managed to do it through this COVID. I have to be honest and say we struggled for a long time whether or not to attempt to get core certification, mainly because of our size. We were unsure whether it was the correct path for the company. We thought that the costs and the additional time required to implement and maintain a program like core, it wouldn't allow us to continue to be competitive. Well, you know, I can honestly tell you, I was mistaken. You know, and I believe there's quite a few small GCs and subs out there that believe core is not for small companies. I can tell you honestly, they're mistaken as well. You know, I thought we had an adequate safety program in effect. You know, we spent time, money preparing elaborate policies, procedures, you know, and to be honest, it seemed a lot of them were cut and paste from other policies. We hired third-party consultants, you know, to help us ensure that we had in place a safety program. And then I thought we were done. You know, I thought that we had reached our goals. Again, wrong. You know, we missed the most important part, which is continuing to review, you know, to monitor, discuss, evaluate, and then change what's required. And I think that's what CORE really does. It like Joel says, it allows you to, it requires you to communicate from the top all the way down. If there's one message I can convey today, would be invest in a certified program like CORE. It's not only going to improve your safety on your sites, but surprisingly, it's going to improve your productivity. We found that through CORE, the CORE program that we implemented, communication between everyone on our sites changed. You know, no longer was it every man for himself. There was involvement from everyone. The sites are much more organized, they're clean, and again, surprisingly more productive. You know, I guess I should thank, I really should thank Sobi and her team at 4S. They helped us accomplish the goals for CORE certification through difficult times. It took us a while. You know, I think we thought, oh, we'd be able to do this in 8 months. It took us quite a bit longer than that. There was a lot of, you know, sitting down as a team, reviewing what every procedure really meant, and not adopting procedures that didn't make sense to us and that we really weren't going to follow. So we spent the time, again, with 4S's help, and my daughter, who actually drove the bus to get us there. But we made the changes, adopted CORE as a culture, and everyone believes in it. Everyone's proud of it. You know, we're proud of what we accomplished, and it's worth every penny. As far as the strategic plan that the ministry and Ron had spoken about, I agree with Joel. It's 100%, you know, it's through collaboration and communication that will accomplish our goal of improving safety on our sites. As a member of the OGCA, I've seen firsthand the collaboration and willingness of the ministry to work together to support our association. Through their support, small firms like us that belong to the association, we're able to gain the knowledge that we probably would have struggled to get. You know, the larger firms in our association have been fantastic. They've stepped up and shared all the information when it comes to safety, and that allows us to get this information for free, obviously. Not just the larger firms, you know, even the smaller firms like GemPro, John Dawson, you know, he sent his safety rep. He had completed CORE, and he sent his safety rep to sit down with us, his in-house safety rep to sit down with us and kind of talk us through the process of CORE. It was invaluable. So again, communication, collaboration between the ministry and us, and like Ron said, you know, the proof is there. look at the LTIs as an association. You know, that was achieved by working together, and that speaks volumes.
I'm gonna, Raymondo and Joel, we're gonna get to some questions from the audience in just a second, but I think one aspect that is extremely unique is that both of you, presidents of your organizations, ownership, family run, maybe just comment on when we're talking about a strategy can't come from middle management, a strategy can't come from the workers. It's got to be initiated by top management and get everybody else involved. How hingent on the success that you're both having do you believe is related to the leadership team really believing in what you're doing and having an intention and a real purpose in driving worker safety?
Here, I'll just jump in. I think certainly the commitment from the executive leadership team has a lot to do with the success. It's our safety leadership team that is the most important key in the puzzle, is to have committed individuals leading that aspect of the organization, because they're the ones managing the day-to-day and enacting the plan, and they're the ones communicating through up the chain, back and forth, up and down, what's happening in the field up to executive level about recommendations for change and certainly reporting on the success of the organization as well. And then together in our organization, we make decisions together. Certainly I'm nothing without my safety staff. So for me, that's the key bit of information for us.
Raymondo?
Yeah, I agree with Joel, but as a small GC, we don't have that extensive safety staff. So you're correct, and it has to start from myself, the top, and again, because we are a family-oriented business, it's actually surprisingly easy to sit down and have discussions about safety. It's obviously, there's so many family members in our company that it's important to make sure that safety is definitely one of the frontline discussions that we have.
If I may, Ken, one of the things that we're trying to do with the strategy, and I think all of us as a system are trying to do, is there has to be ownership. I can make a strategy and write a nice little book, but if it's considered as Ron's strategy and not a system strategy, if people don't see themselves in the strategy or feel they have some influence within the strategy, then it just becomes Ron's strategy. It doesn't, and that's what the Auditor General had pointed out in her review, was that, she made a comment that was very telling to me. Ontario is the safest province in the country, but we can't figure out why. And that it was great you had a strategy, but you never measured whether it made a difference. And I think, everyone on this call and everyone in this room and everyone part of the industry, all 500,000 of you, if you believe in something, that's a pretty powerful group of people that can make an incredible difference. But if there's only a few of us trying to influence many, we've been trying that for 30 years. It hasn't really worked.
So I want to move to some questions from our audience. So the first question is from Jeff. Jeff says, there seems to be a lot of fear or hesitation by smaller companies jumping into core. Somehow it seems it could be a fear of administrative work, excessive paperwork, or perhaps it's just a fear of the unknown. So for Raymondo and Joel, Jeff's asking, do you have any insights or thoughts as to what those fears may be, and thoughts on how to potentially overcome them and get the masses into the program?
Well, sure. I'll start with this, Ken. again, we had those same fears. You know, we thought that implementing core just didn't make sense for a small GC. You know, how are we going to manage all this paperwork? How are we going to manage the cost? All I can say is it's worth every penny. Yes, it's expensive. Yes, it's time consuming. But trust me when I tell you, you know, I'm being honest, it will pay for itself. You'll noticeably notice the difference on your sites. You'll notice the behavior of your men. You'll see the sites, you know, the site super, for example, he'll be so much more prouder of his sites. You'll get trades talking with each other. You get trades that typically would come and try to take over a site, let's say a mason. Instead, they sit down and they have the conversation, where can I set up? You know, and they've taken housekeeping to a different level. So again, my advice to the smaller GCs out there is push through it. It's worth every penny. And, you know, I'd even go as far as to offer help. You know, if any of the smaller GCs want to reach out to us, to REMO, I'd be more than happy to sit down and like John Dawson did for us, sit down and explain the process and what to expect. And I would recommend, you know, teams like 4S. Sobe was fantastic.
Great, thanks, Raymondo. Joel, do you have any comments on that, on the question from Jeff?
Yeah, you know, the question to do with fear of implementation. I think as an organizational leader, this is the way to demonstrate, I guess, commitment to your employees, that you truly care for them, and it's a way for them to make a commitment back to you as an employer that they also truly care about the organization. So I think if you have both teams committing effectively to each other, it's not like a blood oath, but certainly it's like it's a no blood oath is what it is. The fear should melt away in terms of the fear of the cost, the fear of the administration, all of that, because you're going to, like Raymondo was saying, you're going to see the transformation of your sites. You're going to see a higher level of organization that's needed in order to deal with managing core on your sites. But that higher level of organization elevates all the other aspects that your people have to deal with on a day-to-day basis. So they become more organized in terms of how they actually manage the construction, because we actually still have to build a building after all, on top of managing all of this. So, you know, site cleanliness, relations with subs, like Raymondo was saying, everything changes and transforms. And you'll find once you push through that initial fear and pain at the beginning, once you have a system in place, you keep nurturing and working on it, but the cost, we don't even think about, you know, a cost element or a cost burden anymore. It's just the way business is done. It's how we have to manage our sites. We have we have great attention from fabulous subtrades who want to work on our site because they know that things are managed properly and things are managed with safety as a priority, and they know that we've, you know, pardon the pun, we've got our shit together. So you know, they can get on site, get their work done, and get off to the next site without running into hiccups. So it's a barrier that has to be pushed through, and it doesn't take too long once you pierce that barrier to see results.
Thank you. Ron, if I could ask you, going back to Jeff's question, he talks about the opportunity to get the masses into the program. And back in November of 2019, the ministry, along with WSIB, made a significant announcement regarding a major investment for the province, for those organizations and employers that want to move towards building an occupational health and safety management system. IHSA recently, or at the in the fall of 2020, put out a survey to its stakeholders as we were building our own strategic plan. And one of the questions we asked is, what knowledge is of there in industry regarding WSIB's Health and Safety Excellence Program and how it can help. And what we found was there's still the need for clarity. There's still the need for understanding. Wondering if you could just touch on what the province has done in regards of making that investment and how organizations who are considering getting into the implementation of a health and safety management system can really benefit from what the WSIB and the ministry has put in place.
Yeah, thanks, Ken. Yeah, we tried back in 2019, and I'll give OGCA credit for being a major driver of this, along with IHSA. When the Tony Dean report came out in 2010 after Metron, he did recommend that we needed to create a program to incentivize business to become better, to establish a more systemic approach to health and safety. And so we looked at the Supporting Ontario Safe Employer Program, which is the CPO's program for recognition. But what I didn't want to have happen, and I think with both IHSA and WSIB in the industry, and I'll talk about construction, but there were others that were involved too, that we wanted to make sure that those systems linked together, that if somebody was striving to get core, and this is important to the original question, how could we ensure that they could get some form of incentive back for participating in it? Because core had a problem as well. People would sign up for core, but they wouldn't do anything, but they could put on their bid that they were signed up for core. So what we wanted to do is to get people moving in completing the project. So we linked it with the Health and Safety Excellence Program, which was at the time being revised to the old safety group program, where there are about 80 to 90% of the requirements of core can be found somewhere within the 36 elements of the Health and Safety Excellence Program. And anybody that completes those elements that get credit for core or credit within the Health and Safety Excellence Program can receive up to $5,000 on an annual basis, or $1,000 for a completed element. So that's one way we've linked it in. The other way that we've linked it in is that people that have completed Core 2014 that want to become Core 2020 certified, there's 4 modules or 5 modules that they have to take. They can take those modules within the Health and Safety Excellence Program and get that same rebate back. And once you've achieved Core 2020 and gone through the audit process, you're eligible for my program. And if you're let's say a medium-sized GC, so we have a company that's got 200 employees that we're recognizing coming up shortly, they're going to receive anywhere from $30,000 to $50,000 per year. Well, it's in the first year, let's say 50,000. Second year, it's a declining number, 40,000 next year, 30,000. But for all intents and purposes, they're going to get a really significant rebate because they've been recognized by the Chief Prevention Officer because they got Core 2020. The same way if you're a manufacturer and you're ISO 45001, I recognize that one and you're eligible for the WSIB rebate. So a large firm, as an example, there is a cap, but as a big company, Ellis Dawn, they would be eligible over 3 years for $600,000 in total in a declining scale. So some small companies could receive, $15,000, $10,000, $5,000. They could receive up to $50,000 or for the 3 years. So what we want to do is, if you've gone to the trouble to do this, you've gone to the trouble to get Core 2020 as a constructor, and you've went through that, you've maintained it, you keep up your good work through your audit process, you will be incentivized for those initial 3 years. You will get a plaque, you will get a sticker, you will get something on your truck like Core, but most importantly, in the front-facing WSIB material, if somebody's investigating you you will have a sticker by your name that says you have completed the CPO standard, or you've completed the elements of the Health and Safety Excellence Program. We want to make sure that everybody from the premier on down knows that you're a good actor. So we've tried to link those things together so that they're not running in parallel and competing against each other.
Excellent. I want to go back to the questions from the audience. We had one from Liza. So Liza is asking, Raymondo, core is challenging for a lot of smaller family businesses, hoping how REMO can overcome, how you showed in terms of overcoming the challenges, especially in the initial phase. And I'm going to tie that in with an additional question from someone who sent it in anonymously, who's also asking, how do you get that buy-in from upper management? Because I'm going to believe that you've got to tie it in at the same time. If you're going to start this off, it's got to be, again, something that upper management is supportive of. So, Raymondo, what were some of those things that that REMO did right at the start of the process as you were starting to look at improving your safety culture and enhancing worker safety?
I guess at the the very beginning, obviously, was committing, or realizing that we needed something. What we had in place was not working. That would definitely be the first step. The second is communication. I know we live in a world of information overload, but yet we still struggle to communicate with each other. And we put in place miles and miles of paper and procedures. What I would say we forget to do is sit down, is truly sit down and have a discussion with your people and how to change the behavior when it comes to health and safety. And that means at all levels. We're not just talking about sitting down with the super, sit down with everyone, the trades, your laborers. If you do that, those first steps will move quicker, I think, because first of all, you're involving everyone in your we'll call it a business plan when it comes to safety. And when you do that, you have a plan, everyone follows it, and everyone buys in. That would be my first recommendation on how to get started, if that helps, Lisa.
Good, thank you. Want to move to an area that Ron touched on when he was discussing the strategy, which is the areas of focus that the ministry is looking at, which are really non-physical hazards. Physical hazards, struck-bys, falls, MVIs, now looking at non-physical hazards, occupational illness, mental health, workplace violence and harassment. Raymondo and maybe Joel, if I could start with you first, is maybe just how is it that your organization is looking at some of those non-physical hazards that, they've been around for a long period of time, but they're really coming to the forefront now. And I'd be remiss if I didn't add, racism into that as well in terms of looking to address that within the province of Ontario as a whole. So how is it that, from a safety culture perspective, you're incorporating those aspects of non-physical hazards and addressing those? And yeah, so if would you comment on that, please?
Yeah, sure. Well, that's easy, simple answer is communication. So it's building the awareness. Certainly, you try not to overload because again, like I said before, there's so much information, so much stuff can get lost if you're trying to download all this policy and updates and newsletters and all that kind of stuff. So our strategy in the past is to focus annually on an item and sort of keep beating that drum for a year. Whether it was, a couple of years ago, it was violence and harassment, bringing that up as an awareness that, pay attention to that, and hoping that with like the small bites over time, that eventually it'll sink in as something that individuals should pay attention to, and not be afraid if they're thinking, about something to do like this year is mental health. If they're thinking about mental health issues, well, and we're talking about it, then it perhaps legitimizes that in their own minds that, okay, I'm not alone in this, and there's help and resources there. And so, you know, that ongoing communication managed in a way that's not overloading, I think is the key to delivering that message.
Raymondo, do you have anything to add to that?
Yeah, sure. I mean, I completely agree with Joel. It all has to do with communication. You know, violence and harassment has, for us as a small GC, you know, we've noticed the change since everyone has implemented, you know, a zero tolerance when it comes to violence and harassment. I remember some of the sites people, you know, when I was working on the field, you would see the, you know, in your face attitude, the name calling. It doesn't happen anymore, you know, at least not on our sites that we, you know, that we see. Everyone seems to work together, and they understand that they're going to have difficult times, but communication, like Joel said, is definitely the key to moving, you know, or to keeping the site free. But as a small GC, to be honest, we haven't seen, you know, maybe because we're so small, we haven't seen racism or any mental health issues, at least nothing that has been identified to us as management. You know, I'm sure it occurs, but we really haven't had to deal with it as of yet.
Yeah, I'd say I'll just chime in on the mental health aspect. Also, from our perspective, it's something hard. It's hard to really see on site, but if you're ever talking when you deal with your benefits, when you do your annual reviews with whoever's providing your benefits, and you have a look at sort of the prescriptions every single year, the prescriptions of the individuals within our organization, one of the top two is always antidepressants. Wow. So it's out there. It's something that is hard to see and find, but certainly when you see it reinforced on those drug claims, it's something that needs a lot more attention, I think, than we're able to give or even willing to give right now. So there's a lot of work to do on mental health.
I think I spoke at an event that the industry had held a while back, and you know, I did a little bit of research in it. When you think of the business that you have, it's uncontrollable, heavy demand, works in inclement weather. I mean, when you put it all together, the exposure, the difficulty, the hardship, the environment, you know, it's not the equivalent of the pool boy in Punta Cana when it comes to working in the wintertime. And, you know, you're right about the benefits. When the one study I read that the family benefits were much higher than the individual employee, because the families were trying to struggle with trying to work with the employee that was having the problem. And the interesting part is the suicide rate, and this was a UK study, the suicide rate for construction workers were 5 times greater than that of the average population. So we know it's difficult work, we know it's demanding work. And, you know, if people are feeling isolated or have, you know, collateral issues that they're dealing with as well, it can only compound when you're working in that sort of stressful environment. So I would picture construction as a very difficult job. And having worked in public safety, I would say construction is much more difficult, but public safety has, you know, has taken upon themselves to really highlight it. I think it's an opportunity for construction to do the same.
You know, when we take a look at, so just to echo your comments, Ron, obviously the physical hazards and all the elements that construction has to do is significant. And when we take a look back at what occurred in March of 2020 with the province of Ontario, and the ability for construction organizations to continue working with such limited exposure from a workplace perspective and transmissions of COVID, it was truly, it was a blessing for one, because we were able to keep working. And two, I think it's just a testament to the ability of the construction industry to be able to pivot and then to utilize the knowledge and wisdom on how to address physical hazards to now address those non-physical hazards. For Raymondo and Joel, when COVID hit, did you find that the foundation that you had in place allowed you to work with confidence that you were going to be able to keep those workers safe?
For sure, yeah. It was almost like a plug and play into the systems we created for managing safety on sites. It was a very quick transition for us. I mean, we were writing policies, faster than government could put stuff out, because our people were asking, what do we do? What do we do? We don't know. And, so obviously we're boots on the ground. We were able to move fast, and we had to sort of create systems and policies ahead of actual policies coming out in order to keep moving. And it's all a testament to the safety systems we had in place. Everybody was prepared and ready to follow a new set of orders, or an altered set of orders on how to manage the day-to-day life on sites.
Yeah, and it was very similar for us as well. We pretty much had core implemented. We were in our final stages of the, we just had the internal audit to complete. So we had our processes in place, and like Joel, and with the help of the OGCA and many other sources, the information was out there. So boots on the ground, we were prepared. We moved very quickly to protect everyone and make the site safe. I mean, the only thing I wish, we'd get some support from, as a small GC, I wish we'd get some support for the cost. We spent so much money keeping our site safe. And to be honest, and to be blunt, we haven't seen any support from a lot of the, owners. It's not going to stop us. We're going to be focused and continue to keep everyone safe, but some support would have been, needed for sure.
We've had a very fruitful discussion. We're coming up to sort of the end of our time together. Just wondering around the table if there's any closing remarks or closing thoughts that wanted to add to the discussion. Ron, if we'd be able to start with you, if there's anything you want to add in closing.
Sure. Anything's possible. And I know Don Wall had printed an article on the 17th. And, we should be starting to look at what is the next step that we want to achieve. Well, the next step is, what is the art of the possible? The art of the possible is this industry proved to itself through COVID that through small numbers of exposures, through its, and I put it in the chat box, its ability to share information, its ability to respond quickly, its ability to communicate expectation to its workers, and that really did should demonstrate very clearly that anything can be done if we put our mind to it. So I just think that this type of forum, there are many people out there that if you handed them the how-to book on how to become safer, or the how-to book on core, they'd get past the first page and either get frustrated or wonder why. But you take those same people, you put them in a forum, and you have people telling them, here's how we did it. Because there's all kinds of people that are visual learners. They want scenario learning. They just, my wife used to sit down and read the book on Windows 7 or Excel, and those things were like this thick. I can't do that. I got to stand over somebody and say, look, can you show me that formula again? And if we share, as someone said, I'd be glad to send my guy or my health and safety person to help you understand that this is not difficult. To be able to get out there and look at the quality of work that, whether it's an IHSA or a 4S consulting firm, there are people out there that they're seeing, how can we do this to reduce the cost and improve the outcome? Because we know one traumatic claim is a huge cost. It pays for the whole thing 4 times over.
Yeah.
You know, and we try to explain that in, you know, to police departments across the province that are reluctant to invest in their mental health or PTSD. One claim is $500,000, yet they won't hire somebody to focus on reducing the problem. So it's all about the investment versus the return. And we know that the immediate return is not there, but the longer term return is sustainable. And that's what we need to look at, because it does save money.
Okay. Joel, was there any comments you wanted to make?
Yeah, just closing comments, just echoes what Ron's saying, maybe in a different perspective, but you know, ultimately as employers, you want to invest in your people. You want to, you know, make their lives as fulfilling as you can on the job, because they're giving you a service that enriches everyone along the way. So investing in your people is investing in the culture of the people, and investing in the culture of the people results in investing in the safety culture, and everything flows from there. So just, you know, one little step at a time is the way to do it. Try not to eat the whole elephant at once. You're never going to do it. So take those little bites and you'll get there.
Great. Thank you. Raymondo?
Sure. I guess this is directed to Ron. I guess as a small GC, communication between the ministry and their inspectors, in my opinion, is the most cost-effective way to support, you know, helping us fulfill our roles as a constructor. I forgot who said we're stronger when we listen and smarter when we share. You know, sharing of the information, for example, you know, workplace accidents and their causes, it'll help us to put in place procedures and, you know, help us make ourselves aware to, you know, to stop further incidents. So again, share the information, communicate with us. I really like the idea that the ministry is going to, they've hired additional forces, and they're going to go through, you know, they're going to start visiting sites through an educational visit first. I think that's amazing. I think that's exactly what we need. We need to go out, talk with everyone on site, figure out what we're, you know, where we need help, and what's the easiest way to accomplish that. Communicate with us. As a small GC, that's exactly what we need.
And that's a good point. And, you know, again, COVID taught us a lot, as you know, that our inspectors are going out, you know, let's say when they do the big box blitz. Well, it's not just we're going to do a blitz this week and then we're going to focus on something else. They've done a sustainable effort, and they were able to measure that sustainable effort over time, which is important. You know, you've heard 60% compliance. Second time around, it's up to 95% compliance when they go back and visit. The linkage between the observation of what the inspector found that would come back to us and say, you know, the lunchroom, the break room, the carpooling, they're the problem. Once we knew what the problem was, we immediately provided the information. After we had implemented, you know, guidance materials, and again, there were like 250 guidance materials. 3 months after that, we said, we need to put a checklist together, because again, people just want something really quick, really important. And that came from the inspectors. So you're right, closing that loop, but also taking the fear out of what an inspector represents.
Absolutely.
When I started in this business, and it wasn't long ago, I mean, I think 2013, when I took over PSHSA, there were consultants that said, wow, you can't be seen with an inspector. That just blows the whole credibility of prevention. Well, you know, inspectors should not be considered as, you know, the Louisiana cop sitting behind a billboard catching speeders on their way to church when they're late. That doesn't stop highway carnage. What stops highway carnage is a good, solid prevention strategy that everybody buys into. And one of the most important elements of our strategy is that it will guide the Ministry of Labor in its entirety, including enforcement, so what you used to remember is the Safe at Work Ontario blitzes that would occur, they no longer exist. What we will be doing is we'll be focusing on how to fix the small business problem with the inspector. Now, yeah, if there's a crack in a tower crane, we may have those things that go along like we did. Those things will still exist because we have to, but inspectors will be part of the prevention solution as much as they will be part of the enforcement requirement as a need to ensure those who don't comply.
Thank you. And Raymondo, can I ask you just to repeat that quote you said? It said, "We're smarter when we listen," and
it says we're stronger when we listen, and
smarter
when we share. So
smarter when we share.
Yeah. So when we go back, share that information with us. If we find out who the bad trades are out there, if we can find out that information, it'll help us make a decision whether or not we have to carry a little bit. Let's be honest. The majority of our, we're not doing design builds as a small GC. We're lump sum tenders. So, majority, we have to carry the low bit. If we have a list of people that are continually not performing their work properly, that helps us. Just share the information. That's all, as a small GC, that's all I would ask.
Absolutely. And, Raymondo and Joel, you both mentioned family. When I think of OGCA, I think of a larger family. And certainly those that IHSA supports, we want to think of them as our family members as well. And, when you're in need of help, that's who you reach to, is your family. And what I heard today was there is a tremendous willingness for people that need help, for those that have the knowledge and the wisdom to pass that help along. And so I want to thank Ron and Raymondo and Joel for your insight and your perspectives. I'm sure it was tremendous for the participants that we had listening in today. So thank you very much. And I want to turn it over to the OGCA president, Giovanni Cotillo, for closing remarks.
Good morning, everyone. I get to bat cleanup over here. I guess I'm the anchor man for everyone. And I've got to say, again, kudos to everyone. The panel discussion was fantastic. I think it drives home the point. The whole purpose of the OGCA is to share information, that we are the purveyors of information. And the OGCA was created out of a need for contractors to talk to other contractors. And so this is just, an example and a furtherance of that. And again, congratulations to the panelists for your candor and the fact that you never hold back. That's one thing I love about the OGCA. So on that, I get to close up shop here. I want to thank the lead sponsor, 4S Consulting. Always on the mark. Again, Raymondo mentioned a number of times their efforts in order to get them to core. That's just one aspect of what they do. They have an entire litany of products and services that they provide out, and I would recommend anyone out there that is in need of them to go talk to them. Want to thank today's sponsor, Northbridge Insurance. Mario, you were great on the call, and just being able to support the OGCA and the IHSA and whatnot is always welcomed. I want to remind everyone that our day 2 panel sponsor was Skills Pass. They assisted us greatly, and they're undergoing a bit of a transformation right now. So stay tuned. We're going to be launching something new and exciting. And last but not least, Ken, and the entire IHSA team being here, and we talk about family. I think OGCA and IHSA have been interlinked since its onset. It's when it was the CSAO still, and just the fact that everyone is working toward a common goal, and that's to get everyone home safely, period. So with that, I want to thank everyone's participation. Thank you all for attending, and stay tuned for more offerings from the OGCA coming soon. So with that, I wish everyone a healthy and safety day. What is it? Test negative, stay positive. I think that's about it. So everyone, take care, and thank you very much for this.